Your call may be monitored or recorded. To check the status of a case, press 1. If you are experiencing web-related issues or to learn about how to initiate a case over the web, 2. If you are a member, 3. For prior authorization, peer-to-peer discussions, or other requests, 4. What's the member's insurance company? For insurance purposes, your call may be monitored or recorded. To check the status of a case, press 1. If you are experiencing web-related issues or to learn about how to initiate a case over the web, 2. If you are a member, 3. For prior authorization, peer-to-peer discussions, or other requests, 4. What's the member's insurance company? For radiology services, press 1. For musculoskeletal services, 2. For cardiology, 3. If you have recently started a case, please be aware it may take up to 2 business days for your request to be processed. To track the status of your request, please use our online portal.
This is what a prior authorization looks like for a guy with shoulder pain that's failed cortisone, failed physical therapy, and needs an MRI of his shoulder. And this is what we have to go through to get an MRI paid for by his insurance. So we'll just keep track of how long we're on the phone dealing with this. Because, you know, I order shoulder MRIs 5 times a day, right? Good old music at least, right?
This is Valentina. Thank you for calling. Is this for a new account request?
Yes, it is.
Alright, can I have your first name and last initial, please?
Jeffrey Gold, G-O-L-D.
Thank you. And Mr. Jeffrey, are you the patient or doctor's office?
No, I'm the doctor calling.
You're the physician calling? Okay.
Yep.
Can I have the case you're calling about?
It's regarding for a shoulder MRI.
Okay. Do you have the case or the patient ID number?
I have the patient ID number. His policy number is...
Thank you. Okay. You said... Alright, how can I help you today?
I'm just trying to get a prior authorization for his shoulder MRI that I ordered.
Okay. Well, the MRI that I see that was recently ordered, Dr. Gold, has
Yep.
actually been canceled. It was ordered on 5/7. Let me see why it was canceled. Started online, and they voluntarily canceled it online. I'm not sure why they did that. But what I can do for you is I can go ahead and build you a whole new case.
Okay, yeah, just
And, we can...
just whatever I need to get it done.
Yes, sir. Okay. If you'll just bear with me, I'll go ahead and get that started for you. I'm going to have to verify some information from you as I go along.
Yep.
Alright, for high tech. That's going to be for 73221 MRI upper extremity joint without contrast.
That's correct.
Thank you, sir. Is this request for preoperative imaging for custom shoulder replacement surgery and or intraoperative navigation?
No.
Thank you. And is that going to be for the left or right side?
It is for, let me just double check, hold on.
Sure.
I believe it's the right, but let me just double check on the note. Yes, right shoulder.
Right shoulder, thank you. And what is the diagnosis?
The diagnosis is shoulder pain.
And 25.511, pain in the right shoulder?
Sure.
Is that the correct diagnosis code?
Yeah, perfect.
Thank you. And may I have your MPI number, please?
Sure, it's...
Thank you, Sister Gold. I've got you at 1 Wilder Road.
No, that's incorrect. I have a new address.
1 Dove Avenue.
It's 123 Pleasant Street.
All right, one moment. 123 Pleasant Street.
Suite
The zip code?
Suite 105, and the zip code is 01945.
Hold on. What was the zip code again? 81.
01945.
Thank you. Marblehead, Massachusetts.
That's correct.
Thank you, sir. And internal medicine or family practice?
Family medicine.
Thank you. And let's see. Since I don't have your address here, I'm having to add everything, so I apologize. What I'm going to do is I'm going to get you connected over to a nurse to complete the clinical portion, okay?
Okay.
Before I get you connected over, sir, was there anything else I could assist you with today?
Nope, that's it.
Yes, sir. Thank you so much for calling. Please hold while I connect you. Have a great day.
So I know it's Nurses Week, and obviously I love nurses and I have nothing against them, but the fact that I have to get approval from a nurse to order a shoulder MRI is pretty sad. So now, 11 minutes. That goes to show you how many MRIs I order with them since they haven't had my new address for 4 years. Oh, people, wake up. Nothing. I have nothing better to do. This is why most regular insurance-based practices have about 10 to 15 people at the front desk doing stuff like this. While doctors are seeing 20, 25 people a day.
Sir?
Yes.
Okay, I apologize that you're all this long. This is a good wait for the nurse. I'm going to go ahead and do the clinicals with you myself, okay?
Okay, thank you.
Let me. Let's see. All right. Apologize, I'm just pulling that up right now.
Okay.
Okay, which anatomy will be examined? I believe you said it's going to be the right shoulder.
Correct.
Thank you. Shoulder, right side. Which one of the following best describes the reason for the requested study? Evaluation of shoulder pain, evaluation of osteochondritis dissecans, evaluation of osteoarthritis, evaluation of tendonitis or bursitis, evaluation prior to total shoulder replacement. Excuse me.
The evaluation of shoulder. Be the first one.
Evaluation. Thank you. And if you know it right away, you can always just interject. I don't mind.
Okay.
What is the approximate date of the most recent face-to-face evaluation with you for this condition, or with any provider for this condition, actually?
Yes. He's been, the last face-to-face really was with his physical therapist. He's been working with his physical therapist with no improvement, so I would say last week, some point.
Do you have to have an approximate date?
Say April 25th.
April 25th?
Sure.
Thank you. Has there been a provider-directed conservative treatment for this episode of right shoulder pain?
Yes.
What is the approximate date of treatment first started?
It started in, let's see, by my notes here, I believe it was in the end of February, early March. I can get a date for you though, hold on. I first saw him back in, yeah, it was March 4th.
March 4th?
Yep.
2019?
Yep.
Right now I'm going to give you a list of treatments that could have been used for conservative treatment. NSAIDs?
Yes.
Oral steroids?
No oral steroids.
Steroid injections?
Yes.
Yes for steroid injections, okay.
Yes.
Analgesics?
Yes.
Home exercise?
Yes.
Physical therapy?
Yes.
Bracing and or immobilization?
No.
What is the approximate date of the clinical reevaluation was performed after completion of conservative treatment?
April 4th.
Thank you. Has there been an x-ray of the right shoulder since the symptoms started?
Yes.
What was the date of the x-ray?
The date of the x-ray was March 19th.
And was that negative, abnormal, or are the results not listed?
Negative.
Thank you. Symptoms are improving, same, worsening, or unknown?
Worsening.
Thank you. Has there been previous advanced imaging to evaluate for right shoulder pain?
No.
Do you have any additional information specific to the health condition you would like to provide?
Nope.
All right. Okay, it says it does wish to submit, it's going to submit this for additional review. And 1 second. Okay, and so this request is now pending for review. But it's gone to medical director review. When is the patient scheduled to have the procedure?
We can't schedule it until we get the approval.
Okay, so medical director review usually takes about 2 business days.
Okay. And what's the purpose of the medical review? Because usually as a physician, that's...
physician review. If you'd like, I can get you to a physician's line to see if they can get you peer-to-peer.
Yeah, because I mean, I'm the physician that looked at them and examined them, and I'm not sure why I need another physician to approve what I'm ordering.
I'm not sure. It doesn't tell me what indication it was for it to go to review.
Okay.
It doesn't give me that information. If I had that, I'd be happy to give it to you.
Okay.
But in the meantime, I'll get you over to our physician's line, see if we can get you in for a peer-to-peer, okay?
Okay.
Yes, sir. Was there anything else that I can assist you with? Oh, did you get the case number for me?
You gave me the case number.
Yes, sir. Thank you so much for calling. Please hold while I connect you and hope you have a great day.
Okay, thanks.
Thank you. Pleasure.
Your current hold time is less than 1 minute.
So we're now at 20
Did
minutes.
you know that you can now
physician
request
time.
a clinical or peer-to-peer consultation online? Please visit
This is where your premium dollars go.
www.evercore.com/providers.
This does not require a provider login and password. Please scroll down to request a consultation with the medical director/therapist and select the time and date box.
We continue to be HIPAA compliant, taking every measure to ensure the privacy of protected client information. Please hold for the next available representative.
Good morning, this is Natasha G with the Physician Support Unit. May I have a case or reference number, please?
Yes, it's
Thank you. May I ask who I'm speaking with?
Dr. Jeffrey Gold.
Thank you, doctor. May I have confirmation of your patient's name and date of birth?
So this is 2 days later that I'm now getting informed by my office manager that the insurance company that we spent 30 minutes on the phone with the other day to get an MRI of the shoulder reviewed and approved has actually been denied. So now I'm going to get on the phone with them and waste more of my time to figure out what their clinical reason is for denying this. So part 2. Hi, this is Dr. Gold.
Yes, I'm sorry, I didn't realize they were putting you on the phone. My name is Jennifer, patient representative with Evercore Healthcare.
Yep.
I'm just calling to give notification of denial for an MRI of the right shoulder that was requested for patient.
Actually, it wasn't requested, it was ordered. So I'd like to know why it was declined.
All right, give me a moment, I'll pull that up. All right, so it says that the guidelines support advanced imaging and newer changed musculoskeletal signs and/or symptoms after clinical reevaluation shows a failure of significant clinical improvements following a recent 6-week trial of provider-directed conservative treatment with a clinical reevaluation.
That's exactly what he's been doing, and that's exactly what I spent 30 minutes relaying to someone 2 days ago. Like, I don't just willy-nilly order MRIs, so if there's someone clinical that I can speak to, I'd really appreciate it.
Okay, I can put you on hold for just a moment and I can get you over to nursing, okay?
Great.
Thank you.
So I have an MD, so I can now confer with a nurse. Nothing against nurses at all. Now, so just imagine this though, in a typical office, this is why they have 20 people at the front desk to do this crap. And unfortunately, most of them are non-clinical, so they just say it's declined, and then we end up having to fill out more paperwork or get on the phone while you're trying to see 20, 25 people a day. But at least now I get to jam, right? Healthcare system in the US. Yeah. Go to school for a long time so you can get rejected over and over and over again. Feels like my dating life in college. Would you like to go out with me? You have been denied. It's like, no, I ordered the MRI of his shoulder 2 days after he came in. We didn't try physical therapy. We didn't try cortisone injection. No. It's been going to PT. PT calls me. It's like he's not improving, getting worse, needs an MRI or to see ortho. So I said, when we start, do the MRI to see if it's something surgical. But instead, I can't make a decision. Do you like how I rephrase it though? And they're like, was requested? I'm like, no, wasn't really requested. It was ordered. Oh yeah. I like the breakdown. A little clapping in the back.
Makes me want to watch, makes me want to binge watch Stranger Things.
Yeah, it kind of does, yeah. Just a day in the life of a United States primary care physician.
Dr. Gold?
Yes.
My name is I'm a nurse Nurse Clinical Reviewer. It's my understanding we're looking at case number. So we got a 64-year-old male patient of yours. You're a family practitioner. We have an MRI upper extremity, right shoulder without contrast. It appears to be denied. Based on our core musculoskeletal imaging guidelines, we cannot approve this request. Guidelines support advanced imaging for new or changed musculoskeletal signs and or symptoms after clinical reevaluation. Shows a failure of significant clinical improvement following a recent within 3-month, 6-week trial of provider-directed treatment. This treatment might include rice, NSAIDs, narcotics, non-narcotic analgesic medication, oral or injectable corticosteroids, viscosupplementation injections, doctor-directed home exercise program, cross-training and or physical or occupational therapy, or mobilization by splinting, casting, and bracing. Clinical information provided does not meet these criteria, therefore the request is not indicated at this time. So are you calling for a reconsideration of this case?
I'm calling because everything you just stated, I explained for 30 minutes on the phone 2 days ago that he's done. He's been doing PT. I've injected him with cortisone. He's been taking NSAIDs. He had a negative x-ray. The injury was back at like the end of February, like early March.
Okay.
I get a call from the physical therapist that he's unable to progress with PT. So I'm actually trying to save money by not sending him to ortho in case there's nothing surgical and just doing the MRI. But apparently I'm not allowed to make a medical decision. Like, screw the guidelines. Like, I'm the one in the room taking care of the patient, fielding the calls from him and his PT that he's not improving. So would you guys as an insurer rather go pay claims to have him see ortho 3 or 4 times, get the MRI anyway?
I would like to connect you to a reconsideration nurse reviewer so we can do a reconsideration of your case.
No offense, but how about an actual physician? Is that possible?
Sure, one moment, please.
Thank you.
Thank you for your patience.
Well, it's a worrying thing. Oh yeah. But I get to jam. Slow jam. Goodness, wait till. Oh my god, this is so early painful.
Thank you for calling today. My name is Tatiana Smith, Physician Support Unit. How may I assist you today?
Yes, I just got a denial of a shoulder MRI that I'm trying to order for a patient.
Yes, sir. So I'll be more than happy to look into this request today. You did inform me you are Dr. Gold.
Yes.
May I have you verify your patient's name and date of birth, Dr. Gold?
And I will get you his date of birth in 1 second. Oh, surprised you don't have that on file because I've only given it about 12 times.
I'm sorry about that.
Yeah, I'm sure. Let's see. Hold on 1 second. So.
Thank you. And are you looking to do a peer-to-peer now?
I'm ready.
Okay, so what I'm going to do is put you in a brief hold while I try to reach out to a doctor to see if they are available to do a peer-to-peer for us now, okay?
Okay.
Just bear with me just a moment.
Yeah, right back into the slow jam. It's the clapping. Any song that has clapping in it, I really like. Like, do you listen to Kings of Leon? No? Do you like Kings of Leon? No? Those are useless. They have a great song called Rock City that's got a lot of, like, claps in it. It's good. It's like, Take the Money and Run by the Steve Miller Band. You know that song? They have the little clap. You know, like the part I'm talking about, the clapping. It's great. Seriously.
So what you're saying is you're a fan of clapping.
No, I'm serious. Name any song from any genre that has clapping in it and prove to me that it's not good. I'm telling you, every song that has hand clapping in it is fantastic.
If you're happy and you know it.
Clap your hands.
Garbage song.
It's a great song.
It's awful.
It's like the Hokey Pokey.
Oh, that's the worst.
That is the worst.
Nope.
That was like
It's like a
freak
fake
out.
Fake
Little
out.
freak
They're
out. We got you. It's like you only have 4 people waiting in your waiting room. We don't give a shit. See, they never expect to get a physician on the line, ever. I enjoy this way too much. This is Dr. Gold. He's losing his mind. Yeah.
This is Dr. Gold.
Yes.
Alright, so I do have Dr. take this peer-to-peer call for you. And is there anything else I can further assist you with today before I connect you over?
Nope, that's it.
Alright, so thank you for calling. Have a great day.
You too.
Hello, this is Dr. speaking with, please.
Dr. Jeffrey Gold.
Hi, Dr. Gold. Understand you're calling in on a peer-to-peer. Thank you for your time. Let you know the call is recorded for quality assurance. For the HIPAA part, if you'll confirm the patient name and date of birth, please. And a request for an MRI of the right shoulder. How can I help you? What's going on with the patient?
I just need to get the MRI done. He's been doing physical therapy. I've done a cortisone injection. I'm getting calls from the PT and the patient that he's not improving and getting worse, and I just want to further evaluate. He's already had an x-ray that's negative. And we can either pay for multiple ortho visits that may be unneeded, or we can get an MRI and see if he just needs an intra-articular injection or if there is something surgical going on there.
All right. Well, let's try the time frame. I think that was basically what we need to kind of filter through a little bit. And it sounds like he's going to meet the criteria. I just need to kind of document that. So you started seeing him recently. When was his initial encounter with you or another physician or provider for this recent shoulder?
It was the end of February, beginning of March.
Okay, all right. And then you've recently had contact either with him and or the physical therapist. What was that last contact?
The last contact was about 2 weeks ago, right before I started this whole process, which has taken about a week to get done.
All right, yeah, this was submitted on the 8th into our system anyway, so at least this case.
Right, well, no, what we do, see on the clinical side of things, what we do is we put the order in to get the MRI, which was done a week ago, but then we're told by the imaging center that, of course, it can't be approved, or that I have to call and go through the 20 hoops that I've just jumped through just to take care of a patient. So part of my frustration, but it's a little disheartening, to say the least.
I'm sorry for your frustration, yeah, but it doesn't get to our reviewers until that it started as a case, and it was 2 days ago. So
yeah, no, just the whole. I mean, I think you can maybe put your physician hat on for a second and understand that it's not my issue is this process even necessary as a whole? I mean, I'm not ordering, as a primary care physician, I'm not ordering 8 shoulder MRIs a week on patients. I don't just order an advanced imaging study willy-nilly. So it's frustrating to be the physician who's actually seeing the patient, taking care of the patient, to be told that your medical decision-making has to be reviewed by somebody who's not even talking to the patient. So that's where my frustration is. Not...
Well, just similar to an air traffic controller doesn't have to be flying the plane to know that they should have there's times that guidance need to be had, and then there's a significant overutilization of imaging in this country, and you may be the one of the folks that doesn't overutilize, and it sounds like you're not, and so I don't have a way to verify. I don't see that your activity on here. I just see this one case. But there's a tremendous, greater than 30% increase, and it's not sustainable. Even Medicare is going towards a clinical decision support requirement, which our guidelines are qualified by.
Yeah, so I think.
So I mean, there is significant.
I'm well aware of that.
There's a large number of physicians that don't use conservative measures that you have already appropriately done, and that documentation and what we need to have for the health plan to cover the cost of those ordered procedures is a great part of it, in making sure patients are not, because MRI unfortunately is overly sensitive and in many cases overestimates disease, and it's really the clinical care and in clinical examination that's more accurate than imaging is, and so that's kind of some of the background and reasons for it. But all that said, let me get you the authorization code. You so kindly provided information that does help me approve it today. Authorization code begins with the letter A.
So, thank you for doing that. Just a little feedback on my end is I think where maybe what we can do to help this process as a whole is where the patient or their employer is the one that's paying the insurance and I'm not getting paid to be on the phone for a half hour. How about we contact the patients to tell them that maybe it's being overutilized or that you're not going to cover it? Because
the patients are notified when the information that the ordering physician or ordering provider does, but it is a care aspect of the fact that you as the physician seeing the patient, your license is ordering it, your NPI number, your agreement with the healthcare company to take care of their members is part of that. So, but the member, the patient is notified that when something doesn't meet criteria, or at least information hasn't been provided that supports the criteria for the examination.
Okay. All right. Well, I appreciate your time and thanks for taking care of that for me.